Hey guys, Dr. B here. Let's talk about jumper's knee today. What is it? What are some of the causes? What's the clinical presentation? So with no further ado, let's go ahead and get on into it. First off, jumper's knee is just a layman's term for an injury to the patellar tendon. It can either be patellar tendonitis, patellar tendinosis, and I'll get into the difference between those two terms in a later video. Let me just start off by saying I don't really like the term jumper's knee. Let's call it what it is. So try not to use the layman's terms because knowledge is power. So if we can be a little bit more informed as to what's going on with our bodies, it will help us in the future as far as preventing injuries and whatnot. So jumper's knee is a relatively common injury. Roughly 20% or so of jumping athletes are affected by this. There's males, females, they can both be affected the same. However, usually males are affected a little bit more so than the females. Those that participate in sports such as basketball, high jump, volleyball, but also maybe even some sports less common to see this injury in sports such as running, cycling, weightlifting. But you can have an injury to either the supra or infrapatellar tendon in these sports. Oftentimes physicians may use the terms runner's knee, squatter's knee, jumper's knee interchangeably. So just don't be confused by that. So some of the causes of patellar tendonitis, patellar tendinosis are going to be just repetitive stress to those tendons. There's usually not a mechanism of injury associated, and it's usually just a gradual onset. The patient may present with anterior knee pain, pain on palpation of the patellar tendon. Also, you may notice that there's an increased tightness in the hamstrings or the quads. However, you usually see normal range of motion with the knee. There usually is no deficit in strength or flexibility in the knee as well. So there's 4 stages of this condition. Stage 1 would be that you just have pain in that patellar tendon after jumping. It's not prolonged, doesn't really affect your performance. You're able to perform at a high level and you just have that pain. Stage 2 is going to be pain during, but also pain after jumping. You're still going to be able to perform at a satisfactory level, however. Stage 3, it's a little bit more serious. Now you have prolonged pain during and after jumping, and you're not able to perform at a high level. You have a marked decrease in your performance. And then stage 4 would be a complete rupture or tear of that patellar tendon. So that's just a basic kind of overview of jumper's knee, patellar tendonitis, patellar tendinosis. So if you have any questions, comments, concerns, feel free to contact me on Instagram @SportsPod and Twitter @TheSportsPod and #AskDrB.